Yeah, thank you. The study's a multi-centre prospective cohort study, which was defined to really give us a granular look at the impact of the pandemic on multidisciplinary cancer care delivery and outcomes in the pandemic. The cohort was comprised of consecutive outpatients, which were seen at two large US cancer centres, the Mount Sinai Hospital in New York and the Dana-Farber Cancer Institute in Boston. And we collected data at baseline at an index week in March in the preceding 3 months, and then at 3 months follow-up, which is what we presented on at ESMO 2020. And the primary objective was to examine the impact of COVID-19 on clinical care. The primary endpoint was looking at changes in visit utilisation, so total visits, in-person outpatient visits, and telehealth visits. And then the secondary outcomes were looking at defining the outcomes of patients who developed COVID-19, pandemic-related delays of planned oncologic care, and identifying groups which were subject to a disproportional burden of care disruption from COVID-19. With regards to what we found, we had 2,365 patients. 41% of patients had a decrease in total visits. 52% had a decrease in in-person visits, and 32% had an increased frequency of telehealth visits. 5.4% of our patients had developed COVID-19 illness by the 3-month follow-up. And perhaps the more interesting part or more provocative has been looking at changes in care delivery, where we used a multivariable logistic regression model to look at which patients were subject to a disproportionate burden of care disruption, COVID-19 illness. When we used this model, we found Hispanic patients experienced a significant reduction in overall visits compared to white patients. The adjusted odds ratio for that was 1.34. We didn't demonstrate a difference in visit utilisation for Black patients or other ethnic groups. And when we looked at telehealth visits, both Black and Hispanic patients were less likely to experience an increase in the utilisation of telehealth during the pandemic period. And so the adjusted odds ratio for that was 0.69 for non-Hispanic Black patients and 0.71 for Hispanic patients. And so what we saw there was a disproportionate increase in the utilisation of telehealth for minority patients. In addition, 5% of patients had been diagnosed with COVID-19 during the 3-month follow-up. Patients diagnosed with COVID-19 were disproportionately non-Hispanic Black or Hispanic patients, and both those findings were statistically significant with an adjusted odds ratio of 1.86 and 3.19 respectively. And so in summary, what we found was that 52% of patients had a decrease in the number of in-person visits. We had 32% of patients have an increase in telehealth visits, but Black and Hispanic patients were less likely to have an increase in the utilisation of telehealth, and at the same time experienced a disproportionate burden of COVID-19 infection. And so overall, the minority patients experienced a disproportionate burden of cancer care disruption.